Hey everybody, back again. This video kind of goes along with the other one talking about antibiotics. So patients always call for sore throat, runny nose, cough, which can absolutely be caused by a bacterial infection, but a lot of times this presentation is viral. So that can be decided upon two different ways. One, we can test you for viruses. There is a way to do a swab and test a patient for multiple different viruses, but unfortunately it takes about 72 hours to come back from the lab. So typically it's a clinical decision for me to say, okay, what are the symptoms that are present? How long have they been present for? And do I see any red flags that are going to make me think that this is a bacterial infection, like strep throat, like a sinus infection, like a pneumonia? Those are going to be bacterial infections that we often see in the clinical setting. So if your provider tells you that they think this is a virus and they have tested you for the rapid viruses, which we typically test for in office, which are going to be COVID and the flu, which there are treatments for from a medication standpoint, most of the time, my treatment for viral infections, if there is not a bacterial infection present, is symptomatic treatment. And that's going to be for most providers as well. There is not a treatment outside of for COVID and the flu for viral infections. And patients always say, well, what other viruses are out there? There are a lot. That viral swab tests for about 19 to 23 different ones, depending on which viral swab you're using. So things like rhinovirus, adenovirus, norovirus, which people are more aware of now because of the issues that happened on the cruise ships recently. So just important for you to lean on your provider and their clinical knowledge. We understand that you want to get better as fast as possible. We want you to get better too, but in the case of a virus, usually the best option is just going to be that symptomatic treatment. If you take antibiotics and you have a virus, it's really not going to help. So that's when we get the calls back and the patients say, well, I took the Z-Pak, I took the amoxicillin, I took the doxycycline, and I still feel bad. Most likely that's occurring because you have a viral infection, not a bacterial infection. Now, the caveat to this conversation is that viruses can lead to secondary bacterial infections. So let's say my patient says they've had a runny nose and congestion for 10 days. Okay, at that point, we are probably past what started as a virus. Now we've got backup in the sinuses and we have a secondary bacterial infection. So then it would be appropriate to potentially try an antibiotic. So that is just kind of a discussion I wanted to have because it is a frequent discussion we have in the office with patients, bacterial versus viral infections.